Hello, everyone. My name is Jaquise Moore. I am the host of Learning with Jasmine on this wonderful site called Facebook. And we are back at again. We were here this morning, and now we are on Let's Chat number 4. And we have a special guest. And it's interesting because previously before we had guests and I knew of the people, I knew of the topic, and now I'm actually learning today about the brain and autism. You know, those who do not know, I have a child who has autism, and how we met was on Facebook last week. So it's really good that I got a hold of her, and she said yes. So she's gonna introduce herself. She's gonna tell us her professional title and a little bit of expertise, and then we're gonna get started.
So hello.
Hi.
You want me to roll with it now?
Yes, just roll with it.
All right. Hi, I'm Dr. Lynette Louise. Most call me the brain broad. It's fun. I like the term the brain broad because it's really easy to remember. And if you forget my other title, you can always go, who was that lady? The brain broad. Google me and lots of stuff will show up. But I like it for another reason too. In my background, just to give you a sense of who I am, in my background, I raised 8 children. So 6 of my children were adopted and multiply challenged. And 2 of them were biological. I had a 3rd child who died at birth. So that was a lot of children. So that was 9 children altogether, and that I cared about and have shaped my life in many ways. The multiply handicapped children had autism as well as other things, which is a subject in and of itself. This is we're talking about 1984, when nobody knew anything when I started on that journey. And it was quite a cruel world. There was a lot of believing in, first of all, that the mother caused autism by being a refrigerator mother and not being loving enough. So I came to this world with those kinds of learnings. Thinking, no, adopting them, I'll love them, and I'll just be normal. Guess what? That was incorrect.
Right.
So in the process of trying to, it was very incorrect. In the process of trying to help my children, what I just kept stubbing my toe on was that the most the world had to offer, especially back then, was behavior modification in school, which would now be similar to ABA. There wasn't really all the knowledge that there is now about gluten and brain function and gut function and all the things that you poor parents have to try to learn. So you have a different problem from what I had. You have to ferret through this massive amount of information and misinformation. Whereas I had to go in search of any kind of information at all. So I had a paucity of knowledge, and you guys have too much. You have overwhelm.
Very overwhelming.
Right. Where I was benefited was in this paucity of knowledge. I had to focus on my children in a way that you're often, the parents of today entering this world, are often misled by all of the various bits of information, and you go down one rabbit hole and then you go down another rabbit hole, and you're so busy looking for the expert or the magic pill that will help them pop out of autism that you miss your child. And you spend too much time looking for the solution and not enough time creating the solution. That's the problem of today. The problem of yesterday was nobody would listen to me at all because there wasn't a parent group. There wasn't a force of people. There wasn't all this information. Right. And so I had a lot of fighting. That's why I call myself a broad, because I had to be a broad and be tough for my kids and fight the system a lot. Yay! And later, right? And then later, when I became a brain expert, just in defense of my children, I just went, well, if nobody else knows, I guess I'm going to have to learn it. and then adapt it for my children and my situation. So many parents wanted my help that I started traveling abroad. So I'm just retiring from all this, but I have been global for a long time, traveling all over the world, helping families with autism and various other disorders. I work with lots of brain disorders. Autism is my specialty, obviously, because of my life story, right? And just for you to know, only one of my children remained diagnosable and dependent. Another one is what I would call quirky. You could diagnose as quirky. And their thinking processes, all of them, still show up as unique in that they solve their life issues slightly differently than someone else would often, but they are not any longer afflicted enough to be considered on the spectrum. So this is maybe a good place to start. A lot of people say, can you cure autism? Can't you cure autism? There's a lot of, information in both directions. I think it's a better thing to think about it as a graduation. So if you have somebody who's in grade 1, they're not going to graduate college. So think of it like stairs, right? So you have a child. My one child is very afflicted. It's hit his motor system. It's hit, it's just, he's one of those ones that would be very low functioning for a whole lifetime. And fortunately for me, because of my expertise, we've got him where he's integrated into the home and he does his own thing and he's fine in that way. But I couldn't put him out in the world to live on his own. The other kids all can because they graduated. They were far enough along that staircase to off the spectrum that making those healings and those life experiences and those changes developed their brains to a sophisticated enough place that they could literally graduate off the spectrum. Are they no longer autistic? This is a silly argument.
Okay, so let me stop here because you have some good information that I really want for you to continue on. You are doing awesome. I had questions. You already answered my questions. I never.
Sorry.
But to make sure that everyone, because we have maybe viewers that just found out about autism.
Right.
Maybe we have, anyone that's just scrolling around and say, okay, what is going on? So can we break down first autism spectrum disorder and the spectrums, the levels of what you were just talking about, so everyone will be clear on that?
That's good. Yeah, very much so. And I was blessed because in my home, I had every type of spectrum disorder, right? So let's talk about the word spectrum first before we talk about autism. That's what I was kind of describing as a staircase.
Yes.
Let's demystify that for a second. Everybody goes, well, yeah, but it's a spectrum disorder. I'm sorry, everything is. You have a cold or you have pneumonia. It's a spectrum. It's either a sniffle or it's I'm so sick I can't breathe, but it all was the same. It's a spectrum. The concept of a spectrum is you're strongly afflicted, where you're very, very affected by the problem, or you're lightly affected. That's what makes it a spectrum. So that exists in everything. Down syndrome is a spectrum disorder. Being a human being is a spectrum of disorder. Go from white to black and brown in between and red. And everything is a spectrum. So let's demystify that and make it understandable. It's just a word that got married to autism. To try to explain that autism is a confusing disorder because you can't say that, whereas with Down syndrome, you could say, all right, you'll have a problem with the tongue. You'll have a certain shape in the eyes. You might have issues with the heart. Like there's a list that is almost 100% adhered to by the person with this issue. And it's a chromosome you can find. So we can say, okay, this is for real. We see it. With autism, there's not a blood test. There are some things like Williams syndrome is a type of autism in a sense, but once we have that, or Fragile X or whatever, once we have that, we give it that name, and we still give it autism.
Mm-hmm.
So a lot of the time, the children have more than one name for what they have, but that's just because we could find it. It's still autism.
Right.
So autism is a mystery disorder in that sense. It's like we don't know, we can't look at it, do a blood test. I can look at their EEG, their electroencephalogram, and you can, at about 9 months to 18 months, see differentiation. You can see some likelihood. You can see leanings, but it's still not a kind of test where you can go to the lab and say, here you go, or it's just not. So what is it? So how do we decide what autism is? Well, you have some categories. So for example, they call it antisocial.
Right.
But it's not truly antisocial. It's fed by the categories and by the way the brain is functioning. However, it's an antisocial disorder. It's I think it's a better way to phrase it would be to say a problem with social skills disorder, right? So if you have enough of a problem with your social skills, then you would be considered that checking that box on the list of diagnostic criteria for autism. If you have enough of a communication disorder, which could be everything from absolute nonverbal, zero anything, not even asking you to fill my glass by giving you it, to I talk really well and I have a great vocabulary, but I only talk about this subject and that's it. And I'm not going to talk about any other subject and that's it. And I don't have great tone and I don't have a good meter and my voice sounds weird maybe.
Right.
So this is a huge difference, much huger than most spectrums. And that's why we're referring to it that way. So you'd have to have a communication problem that is severe enough to not just, he has a lisp, but a severe communication issue that centers around a subject or absolutely prevents communication. You have to have a social problem. You have to have a sensory problem. So what's a sensory problem? For some people, it's as extreme as they taste squares and triangles instead of flavors. And for other people, it's as mild as I can't stand the feel of socks. Don't even let me see socks. I'm going to run screaming from the room. Again, this is the reason for calling it a spectrum.
Right.
They used to separate the Asperger's. You'll hear the term Asperger's often. They used to separate Asperger's from autism, but in the last version of the diagnostic manual, it's called the DSM-5, they put them together and they claimed it more like a higher functioning or a lower functioning and just put it all on the spectrum, making the spectrum bigger and kind of annoying the Asperger's people. Right. Well, that was worth it. It doesn't really help much, but we have to make money for sitting around talking.
So you're talking about the high functioning to the low functioning. So what the high functioning would be? What would a high functioning look like as a child, for a child?
As a young child?
For anyone that has a diagnosis of autism.
I think that's a really good question for a reason that I like to talk about, which is too often parents or people that are just finding out about autism, they read about a child who got better, like how I told you that I have children that graduated, but I also have one that didn't, right? So they take that story and they think, well, then they can get better, as opposed to, each of them is very different how their brain was affected by this. So somebody who's higher functioning, and Asperger's would have been a term we would often use, but it could also be hyperalexia. They can look very many different ways. Hyperalexia, for example, is when a child reads really, really well. They might be 2 years old and read and be very good at recognizing numbers and seem so brilliant. You think you have a baby genius. But then as they grow, you also can only discuss what's in the books. They're very rigid, and rigid is a term that's often used because the kids, when they get sort of a traffic jam in their head of information, they'll melt down or they'll refuse to let you talk to them about something else because they know they're not going to be comfortable. So this child who you thought was this genius, and often with Asperger's, there is these sort of special things. You'll, as time goes, you'll go, but I can't teach them anything else, or they won't make friends, or they stay in their room all the time, or they won't wear their clothes, or they like all kinds of strange things that show up. So this would be a higher functioning child. It's confusing for parents, so confusing, because you can, right? Like you're like, I can talk to you, and yet I can't.
the most okay, do you want to do this? Yes. 2 seconds later, no. Yes. No. Which one? Which one? I don't know which one. I'm confused. Which one? Yes and no. Yes and no. If it's not yes and no, and oh my goodness, I understand.
Yeah. You have to make one of those stronger than the other, by the way. That's a good example. I usually make no stronger, because it's an important power word in the world of children who aren't listened to. So when you make no the power word, you say, okay, well, you said no.
That's what I started doing. Yes.
Right. I say, I don't ever want anyone not listening to your no, because you're teaching out into the future.
Yeah. That's power.
So I'm going to listen to your no. And then they can, whichever one you choose, though, they'll be more careful with it if you give one of them more power, one word more power.
That's a powerful message right there. That was.
And that was a good one.
That was good.
I can do a lot of that. Yeah. So otherwise you're in a mess, right? But the second you do that, now you can teach all kinds of stuff. You can teach safety with your body. You can say, but first you gotta follow through. So I've taught that a lot, but the parents, they do it for like a week, and then they go, oh man, it's easier to just accept the yes right now because I wanted a yes, and that's on us, right? If you don't want to confuse a child that's easily socially confused by us being inconsistent, you gotta present the lesson every day.
That's good.
Okay, so basically, just to wrap it up, a child with autism has problems with communication, sensory, social skills, and they're very often misunderstood as not liking people, because perhaps an example would be having a sensory problem means that you're very tuned into energy. And when somebody comes in the room and is all, hi, I'm Auntie Emma, come on, give me a kiss. And it's like, oh, that's too much energy, and I run away from you. A lot of people think that then I don't like you. And that's not true. I don't like that feeling that I get when you come and do that. And since I'm stuck in a communication problem, I can't explain all that. I just run away. The adults then go, oh, it's autism, it's antisocial. They start saying things like, oh, my child doesn't like people. And then the child goes, that's a good, easy way out. And you now further the problem by reinforcing it at every turn. So to do that, watch your child, see which things make them run and which things don't, and help them the people to be more conducive, and help your child to be more accepting. Don't reinforce the social problem by constantly telling everyone they have one. It's really bad for the brain to, if you want your child to become more flexible, then you want to help them by exposing them to it a little bit in the most comfortable way you can, or else the brain will wire into sort of a cycle of firing that is really difficult to unravel later.
So yeah, that definitely about positive reinforcement is what I'm hearing. What I'm hearing from you is making sure that, even statements have been like, oh, they have autism. No. That kind of hurts my skin a little bit, because I feel like just because there is that diagnosis doesn't mean that they can't not succeed or complete a task, because, and of course it's wide spectrum of it, but we just got to, like you were saying about getting dressed, we just got to getting dressed.
Right.
We're learning still about same bathroom. you
Right.
know,
Right.
so when those moments of she has, accomplished that moment, may not be every day, there's always like, good job, Jasmine. So proud
Right.
of you. And then that way, the self-esteem also will increase.
Right, right. And it's I like the term positive reinforcement, but it's often
Mm-hmm.
misinterpreted as sort of a magic pill. You do want to be positive reinforcing. In fact, I say I have what I call Lynette law. And by the way, I have a book, by the way, people, in case I forget to tell you. It's called Miracles Are Made, and it's about my kids and how I help them. So if you're
So
interested.
yeah, so what I would do is after everything is after we finish, I will post it on this video so that we
Sure,
can,
sure,
yeah, and
sure.
actually
Uh,
you can post everything that you want to do,
sure,
your
sure,
website, your book,
sure.
whatever.
Sure.
Yeah.
I just wanted to, the reason I brought it up just now is because of where I was going to go in the
Hmm.
conversation. So we call it Lynette law, right? And when I was learning about the brain, I learned about the ratio of correct responding. So the brain learns best at a 3-to-1 ratio, but I made it 4-to-1 to adapt for the fact that our children are more struggling. So 4 compliments to 1 correction. So it's important to know so the problem with the term positive reinforcement is people think you can get everything from the positive reinforcement, but in fact, not everyone thinks that, but many people interpret it that way.
Hmm.
And you also need the correction, right? So what's the ratio? How do I know that I'm responding with enough positive to ask for change without causing stress? And so I came up with sort of a formula that is very effective. So if you say to yourself, geez, I just said, um, tie your shoes differently, put your pants back on, and stop screaming. That's 3 corrections. So how many compliments do you now owe? You see, all of a sudden you're going, shoot, I have to come up with 12 compliments now. I have to ease. So this changes meltdowns immediately. So I have to ease this feeling of persecution, of
We
man
lost you.
coming in
We
my
lost
direction.
we lost you a techno.
At least 4 compliments for each correction in the
Okay.
most important time. Okay, okay. Tell me when I'm back. Thing.
Okay. Okay.
I'm
Okay.
back.
Yeah, we're good. We're good.
Okay.
Yeah. So
So
go backwards a little bit because this is very interesting, and I don't even want to miss this myself. So.
this is life changing.
Yeah.
When you give 1 correction and then you
Mhm.
give 4 compliments, let's think about what you're doing. You're going, here, do this. They emotionally are going, oops, it's hard. I'm worried. And then they hear compliment. Oh, I'm less worried. Compliment. I'm doing good. Compliment. Fantastic. Compliment. I can do this. All right. Correction. Now,
Mhm.
none of us do this steady rhythm this way, but if you've caught yourself doing like 3 or 4 corrections in a row, you owe them a lot of compliments. And the reason you want to give them is so that this learning can become solid. So this learning
Mhm.
can get past this resistance and fear so you can slow down the processing of what you're requesting, because that's also another problem.
Mhm.
The minute your child is worried or just complying, there's 2 different problems here. Worried prevents them from actually learning the lesson. They start looking at you, and it looks like they can't understand you because they're staring at you for visual cues. Like,
Mhm.
let's say I'm trying to put a shirt on, and I'm worried that I'm wrong. So now I'm afraid to think for myself. I don't use my own thought process. I don't look at the shirt myself. I look at your eyes, Mummy, and I'm waiting to see your eyes flicker approval on something I'm doing. So I put my hand in because your eyes are approving. Well, what happens is this sort of need for symbiosis. Like, I need you for me to understand.
Mm.
To get your child independent in a skill, you don't want them worrying.
Mm.
You don't want them defensive. And the way to prevent that is this ratio of 4 compliments to 1 correction.
Mm-hmm.
So the primary method of helping children right now is ABA. There's lots of dietary stuff too, but let's stick with stuff that's more tangible that we can talk about.
Mm-hmm.
The problem there is it's compliance first. There's a lot of good stuff in ABA. I love the constant repetition and whatnot, but you have to be careful of thinking compliance first, because that's also not a child then learning to own the skill. They're doing what's called please the interviewer or please the teacher, and they seldom generalize that skill. It becomes a self-fulfilling prophecy. And so you say, let's use an example. I wanted to be visual for you. So let's say you're trying to get them to sit at the table. So it's sit at the table, sit at the table, sit at the table. Finally, they're sitting at the table, they get a treat.
Mm-hmm.
They're not going to say to themselves, oh, so sitting at the table is a good thing to do. I learn better when I sit at the table. They're going to say to themselves, if I sit at the table, they don't keep bugging me and I get a treat.
Mm-hmm.
That's training, not teaching. That's training tricks and not teaching. What happens? The brain learns, the child learns, but the brain learns in a training methodology that doesn't encourage sophisticated thought. It doesn't encourage self-analysis. It doesn't encourage social analysis. It encourages rule following. And the problem with that is increased meltdowns as you, especially as you hit teenage years, the hormones shift, the needs and yearnings and cravings change. The size is bigger and the child doesn't have to be afraid of you anymore. And that's when you'll see a lot of violence happening. So you don't want to be doing that. You want to, I'm going to correct you. I'm going to compliment you. I'm going to correct you. Get that nice rhythm so that just like all of us, we learn what we like to learn. And you want to make learning fun.
Mm-hmm. Yes.
Is that clear?
Yes, very clear. Yes. I know for myself, I have been guilty. I'm gonna be honest, I have been guilty with the errors at some time. And then I realized that this girl is also stubborn. So she is stubborn, she is shy, she doesn't do well with extra eyes. So I started encouraging her to get her clothes, and I would walk away. I would leave the room. And sometimes it took, it would take like 5 minutes to 20 minutes. I would just be in a different room. And what I noticed was that she responded on her time, on her term. And there was no tantrums, there was no meltdowns, there was no issues with whining. So definitely taking a step back has been a personal difficulty for me, but when I take the step back, she responds differently to the point that, what I would have been, come on, Jasmine, you know, and instead of taking a step back, I'm doing whatever I'm doing. She's doing whatever she wants to do. And then at the end of the day, she's like, ta-da, mommy, I got dressed, and shows everybody her outfit. Now, is it matching? No, it's not matching. It's not matching some days. Okay. I'm like, oh my goodness, like I would not put that shirt together with those pants. But what I'm teaching her, one is independent. She's being independent with that. And two, her self-esteem has increased with a girl who used to run away, like you were saying, run away from happy birthday song because everybody's so excited about her birthday, to now she responds differently with this. This is definitely helpful. So I definitely will continue on setting, taking a step back, but also talk, definitely talking about, making sure my words, the way I say it, instead of put this on, instead of saying, maybe ask her a question so you can choose, so sometimes she say, I want it later, so yeah, definitely.
And an important question to ask yourself always is, am I doing this for her development or my convenience and my ease and my reputation? I want to give you an example since we're talking about dressing. So a young man that I work with comes from a very wealthy family, and he's now a man. I've known him since he was quite young. He's dyspraxic, which for people who don't know means the way that it's affected his brain has really hit his speech center. So getting any words out is very challenging for him, but he has some words. He's worked really hard. With multiple communication, he's able to really be understood, which is really lovely. It was a lot of work. It's a fine motor connection in the brain. And so even if you know that you're trying to say, pass me the guitar, you can't get any of that out. So that's frustrating, and it makes the person look unintelligent when in fact it's a communication problem, which then makes meltdowns and stuff. So he comes from this very wealthy family with lots of maids and people who can make sure his shoes are beautifully matching to his, everything looks perfect and is very organized. And a lot of the problems they were having with his behavior had to do with there were too many steps to get out the door. So they're trying to get their child to school, but you have to wear the perfect pair of socks, the perfect pair of shoes, the perfect pair. There's so many steps that by the time you go to leave, you've already got a traffic jam in your head of uncomfortability. So a lot of people have this problem. They're trying to get their children out the door, and it's rushed, and it's your convenience, and it looks bad on you if your child is late all the time. So your priorities aren't your child's learning. You tell yourself they are. You say, oh, yeah, but at school they'll learn. No, this is something that's hard for your child. This is the lesson, right? This is it right here. Tell the school to wait. So in his case, there were and it started to turn into violent outbursts. And I just said, let's just make a list of all the things he doesn't really need. And then what can he put on in the car? And and they just, had a really hard time because of their culture and also because of, they have a status symbol, letting go of that. But they did better, and he did better. He came to visit me for his 18th birthday and stayed here for a while. And I just let you wear whatever you want as long as you're legal, right? I don't want any private parts flowing in the wind, and I don't want you to get hurt, right? Right. You can't go in the store without a shirt, but I don't care, right?
Right.
So he's a boy who never really takes care of dressing himself properly. But here he dresses himself every day. Why? It's not about the skill then, is it? It's about what you always want to ask yourself, what am I actually getting my child to learn? When you're rushing them about getting dressed, it has to match your taste. And you want some compliance, but you do not want an adult child on the spectrum of autism who complies to all adults. That's dangerous.
Right. Right. I know for myself, I'm very cautious. I don't like to rush. As an adult, I don't like to rush. If I did not know the plan that my family has on Sunday at 2 o'clock, I will not feel comfortable in getting ready at 1 o'clock. That's just me. I don't like rush the rush and be all intense. If I don't like it, you said earlier, to your child feeds off of your emotions. And
Absolutely.
I never really got that until like 6 months ago. And I was like, you know what triggers me triggers her.
Right.
And I definitely take, it could be like 2-3 hours ahead. We are having a smooth sale. Uh, okay, here's your clothes. You pick your clothes out. I'm gonna do this, and I come and you come to me. Not I come to you, but you come to me when you're done. Same thing for brushing your teeth. Everything that goes along with that, because I'm like, okay, at 9 o'clock, and no, it's not gonna work with her because of time. So
Right.
definitely, that's something that is very noted in our life, because I was like, okay, something I have to, parents, we have to change our schedule because we're parents, and that's what it is, and we love it, but when it comes down to knowing your child too, that's something, if your child knows, okay, I have to do this before this, give them leisure time,
Right.
give them
Right.
time to adjust, because children with autism may have transitioning issues, you know one thing to the next. So 5 minutes, and 5 minutes with this, and then we're going to stop this, and we're going to go to this. All right, 2 more minutes at the park, because transitioning might be an issue. So definitely note it.
Right. Right. So, you said so many things that I feel like I could come up with a nugget that would be useful.
Yeah, go
But one
ahead.
of
This is your show.
well, I just, it's important to build off of what people need to hear.
Hmm.
One of the things you talked about is, how to let her go and get dressed and all that. We have to always remember this is a huge spectrum. So you have the parent at home who's thinking, I will be lucky if my child can, put their hand into the mitt, like literally, right?
Hmm.
It's not, it is a big spectrum. You have the child with autism who goes, don't you bug me, I'll do this myself,
Hmm.
right? And then you have the child with autism who's like got this severe motor function issue
Right, right.
and just, managing that. So we're not saying to not adjust this for the situation your child is in.
Hmm.
Absolutely. If it's someone like that, you do have to be there. But at wherever your child is at, you have to know what you're teaching. This is what's missing often. What am I teaching? Am I teaching hurry up so you can go to school and do it there? And sometimes that's okay, but be aware so that you can adjust accordingly. So if you have a child who has trouble just in this motor function, putting their hand in the mitt, you're going to have to be there holding the mitt
Right,
or the sock or
right,
the shoe.
right.
But, you know, you still want to say, I'm teaching, do this yourself. So if the best you can do is, I can't do a glove, but I can do a mitt, buy mitts
Hmm.
because you want to encourage independence. If you, my great granddaughter's at the door going, Grandma, no, drama's still working. Sorry. That doesn't usually happen. Sorry, people.
Yeah, I have my door locked, and she's downstairs with my family. Yeah, it is what it is.
um, anyway, so you want to subtract the thing that in the story that I told you before that's so important is subtracting the stuff you don't need to do.
Hmm.
So you don't have to have gloves instead of mitts. sometimes you don't have, get rid of every pair of shoes that has laces. It's not necessary.
Yes.
You know, really analyze, why did I buy those? Are they cool to me, but are they of use to my child? Like,
Mm-hmm.
really get as much of the work that we've added into our lives that we don't need to have, get rid of it.
Hmm.
And now you're down to the bare bones and they can get independent.
Mm-hmm.
Right? So
And
this
also,
is important.
I wanted to, because there's some activities that Jasmine may have difficulty still. And I'll say, okay, put your hand on mommy's hand. And that way I'm guiding her hand or what I need to do. Now, does it work? Am I still doing the work? Oh, yes, I'm still doing the work, but I'm guiding her hand, you know, and that's
Right.
how, you know, that's something right there within itself of what you just said. You can guide. Okay,
Right.
I'm gonna hold it. I'm gonna hold the shirt. You put your arms up.
Right.
You know.
So let's talk about the brain on that. So that's it's called hand over hands,
Right.
obviously. Right.
Right.
When your body moves it fires in the brain. So I could literally hook you up to machinery that makes your body move,
Mm-hmm.
and the brain will learn how to move in that way as long as the spinal cord is intact and can send the
Mm-hmm.
information. Of course, there's exceptions, but the idea is if I make your body move a certain way enough times, then it does set the brain up to understand how to do that. Mistake is if you don't have your mind on, I'm teaching independence through this. I'm just getting her body used to it so she can go to the next step. You'll be stuck there. Because there's also the part where I use this analogy all the time because it's such a good one for everyone. When you're the passenger in the car,
Mm-hmm.
you don't actually know how you got somewhere because you didn't apply your thoughts. You didn't go, wow, I have to remember how to get here.
Mm-hmm.
So you just kind of like let your head do this and you're daydreaming and, solving the problems of the world. Your children do that a lot when you hand over hand. So when we hand over hand, very often the kids are like in their heads going, so that red brick that I'm going to go get as soon as mommy leaves me alone, it's going to look beautiful on top of the other red brick that's in my tower of bricks, right? And you think you're teaching, and really they're just letting you do it with their hand.
Right. Right.
When you understand that, don't yell at them, pay attention. Yelling at someone to pay attention just gets the child to pay attention to you that you yell.
Mm-hmm.
When you have a processing problem like autism, you don't necessarily connect the dots to what's causing that yell. You just feel your parent's tension, get nervous, and then go, oh, there's the yell. And so what you want to do is go, all right, I'm doing hand over hand, use a nice fun voice, and and you're going to do it yourself soon. All right, your turn. Always
Mm-hmm.
keep the your turn in. And whatever attempt is, even if it's that's it, that's all I got. Yes, that's the right direction.
Mm-hmm.
So now you're building on something so that
Mm-hmm.
someday your hand will be gone.
Yes. Yes. That's good.
And I know what I just described is very low functioning, but you can generalize that if you're not autistic as well.
Mm-hmm.
You can generalize that to, whatever your child's functioning level is.
And as a teacher, that's called visual learning. We're seeing something, yeah, we're teaching. And so I think it's very important to really, when it comes down to like later on in life, you want your child to do X, Y, and Z. They are actually remembering, okay, well, I did this and now I did that. Like even addition and subtraction, we this is where we are with Jasmine right now. Addition, okay, we're gonna go from the right side of the number line when we add. And then the subtraction, why do I have to go on the left side of the number line of subtraction when I was just learning addition like last week. So, making sure, okay, this is where we go, and we're going to guide, those steps to subtraction and to the addition. So I think that's where the visual learning. Okay, you look at me, and look at what I do, and don't do a lot of steps at once, because that's gonna, get frustration or whatever. Okay, let's try the first step, and then making sure that is I guess accomplished or improved, and then we'll go to the second step. That's
actually, especially when it comes to arithmetic, math. This is a great example because there's a lot of academics that really are non-functional for a lot of the kids that are taught anyway. You have to, this is a great example of what we're talking about. What am I teaching and what's the point of it? So one thing about children who have any kind of brain challenge, any cognitive challenge, they really quickly get overwhelmed with a lot of information that doesn't feel relevant to them. And that makes sense. If you don't have the extra brain power to just be idly playing at something to learn, then every time someone asks you to learn something, you don't see the relevance in. It's very difficult to get that lesson to take hold. And often, if you're teaching math and the child seems to never learn and can't go to the next step, it was just because it wasn't relevant. And I'm using math, but we could use anything.
right.
So, but money buys the things they want, and money is math. If they have a sort of a thing for cars and they get, they have 700 cars that they have going around the house in a particular pattern, they care about the number of cars. So when you start thinking about the math, you have to think, what's the relevance of math in my child's life, and how much does I not need, and what can I make tangible and relevant in my child's life? And then you can discover that actually they had the steps, they just weren't interested and they didn't care. And it can be surprising. A lot of times people will think, wow, it's like maybe he's a savant, or no, it wasn't relevant. They don't want to, they're not interested. I don't care about it. But if I can go to the store and buy another car, and I have to understand that I'm adding and then I'm subtracting money when I get the car, and I won't be right. Now I get it. Now it matters to me. So I've had kids also that like buildings, and you can teach geometry that way. So it's very important to make it relevant and tangible. This is just like when I said, get rid of the things they don't need to wear, use Velcro or loafers. They don't need to do the shoelaces. Get rid of the stuff that's not necessary, and you'll get the ability to teach what is necessary, and then it'll generalize, especially if you make it relevant.
I like that. Okay, so we'll have a few more minutes. I just want to possibly, if you can talk about maybe services for with parents, what services we recommend. Bringing it home to, I always stress the knowledge that we present on this Let's Chat. It is so important for parents to, maybe possibly get the resources, but also make sure it's strategies that we can do at home as parents, because it's, not about 30 minutes per week waiting for a service, or individuals, that may have like two or 3 hours per day. What can we do at home as parents? So what services do you recommend? Maybe strengthening the brain, maybe, if that
Sure. Every conversation I have has something to do with the brain. Okay, so first of all, I love that you said things that you can do at home, and added the fact that when you give your power away to all these services that are like 15, 20 minutes, 30 minutes somewhere, but you drove for 2 hours to get there or an hour, or you're sitting in traffic and your kids, right? You literally lost so much time, and you'd have probably done better work at home. So it's really important to always assess, no matter what you're doing, assess your child's time. Am I giving all this tension and energy to getting them to and from that could be better spent just if I played with them for a whole hour? Because in fact, the best way to teach anybody skills that they're going to generalize is play. I'm sorry, but it's a social disorder, and we spend so much time getting compliance instead of being social with our children. So let's roll this back a little bit and say, okay, what is a child supposed to have as a child? They're supposed to have a child's life. They're supposed to have fun. It's supposed to be fun. It's not supposed to be, I'm 18 months old and someone thinks I'm autistic, so now I'm doing drills. That's horrible. That's horrible. So let's just don't imprison our children in this awful educational model that subtracts the actual teachings. Your children have always learned, regardless of disability, from being motivated to play. So you have this motivated to play person, and then you're taking away their motivator so that you can call it a motivator and use it as a reward. Just get in there and play. Children learn so much faster and in such a much greater sophisticated level. Their brain becomes better at multitasking. Transitions become easier. For example, you mentioned transitions. If you're playing with your child and you know that you want to get to the table and they're a child who really likes singamajigs and makes music with them, you go, oh, it's lunchtime. The singamajigs need to eat. And you bring them over and you put them on the table. And, oh, this one isn't able to make his sound. He hasn't got enough energy. You're teaching. You're teaching. So step one is stop devaluing, which I'm sure lots of you aren't doing, but many parents do. Stop devaluing the power of you. And the relationship that you're building with your child, because if you can act like a friend 1 hour a day and play with your child 1 hour a day, like a friend, which means you like how they play, you're teaching social skills.
Yes. So I just want to say, yes, there is always mommy and daughter day. Or, even okay, I have 30 minutes until I have another session that I have to do, and then 30 minutes. I do about 30 minutes to 45 minutes per 2 or 3 hours. So within that time frame, I may, okay, let's do this. Or you want to do this, you want to draw, you want to color, I am a mom with a screen, so we'll do like educational videos. Some parents don't do it, but we'll have everything that's educational, and then we'll play along with it or whatever. So yeah, definitely, I do take I'm hearing what you're saying about.
And remember to go to her interests, not just ask her to come to yours. We spend a lot of time bringing the kids to what we think is good for them. We want to go to theirs.
I know there's always like, what do you want to do? If they would say, if she says, do you want to go outside? And I wait for that yes or the no, type of thing. Do you want to do? Because again, still is about, can she communicate? So if there's no communication or,
that's what I was going to say. So you can't always ask a question like that with all the kids. I ask questions. I do. Lots of them. But often what you want to do is, let's say they're engaged in doing this with a ribbon, and they're not a child who can respond, where you can just say, do you want to do this or do you want to do that? They're doing what they want to do. So step one, recognize that. They're doing what they want to do. You're now entering their space, just like if any of your friends come over and you were in the middle of reading a book, you were already doing what you want to do. If your friend's going to get you to do something else, they have to be more fun than what you were already doing. So if I'm doing this with a ribbon and I think it's fun, then probably I'm going to pay more attention to you if you sit down and join me for a minute and say, oh, that's cool, and play with some. If I don't like ribbons, I don't want to be disingenuous. So, if I don't like ribbons, I might sit down and draw a picture right beside. It doesn't have to be the exact same thing. And then evolve it. Well, there won't be a transition issue if you do this, by the way. The transition issue is often because we're saying, what do you want to do? And they're like, dude, I'm doing it. Right? So you want to pay attention to the messaging that you give. And this is all brain related because everything is brain development. But I want to answer, before we go, a couple of really basic things that can be life-changing. Let's talk about magnesium for a second. Like, a lot of the times, this is just something you can go to the store and try, right? I don't want you overdosing your kids on magnesium. It's not going to heal autism. But there are a lot of kids with autism who have difficulty passing their bowels. It's a very common problem. And the doctors are going to, they'll say stool softeners, they'll say, laxatives, they'll say fiber things. And often it's a deficit of magnesium. And for some reason, they don't say it, right? But when you tell them, they go, oh, yeah, that makes sense. So know that if you have a child who's having to stand to poo, or who's having having very hard, dried out bowel, it may be as simple as they're low on magnesium. But magnesium also affects your brain function in a huge way. It affects your anxiety in a huge way. It affects tics in a huge way. It affects your heart function in a huge way. So you have this one simple supplement that is commonly an issue, and you can just try it. I mention that because, first of all, it's so simple and it's not damaging to just give it a try and see if it helps your child. And it's not me selling you a product that I'm making that is called Perfect Pure Potty Going or something, right? I'm telling you that a lot of these things can be very simple. And there are so many people hawking their wares and giving you false ideas
We lost you. Hold on.
What, this supplement. Are you back? Am I back?
Yes,
Am I back? Am I back?
Yes.
Okay.
Okay, go ahead.
So just a couple simple things. Sometimes they need a little vitamin C too with that. Vitamin D is wonderful. And these things are important to have in balance. Let's go back to magnesium. I'll just focus on that because I don't want to overwhelm. But when your magnesium's in balance, then you're going to have better brain function. You're going to have better muscle tone. Your muscles won't shake and jitter the way they normally do. Your heart's going to function better. If you have too much magnesium, you'll get diarrhea probably, so you can back it off.
How much?
You don't have the right amount of
calcium. How much would it be? The dose would be like if
right. It depends on the problem. So,
okay.
Just, it's not a bad thing to try. It's not something where you have to worry and then pay $3 million for. It's a simple thing, right? And it can be so life-changing. You can go from never being able to train your child because it hurts them so much to poo, right? And they're holding and they're hiding to now they're comfortable day upon day. Same with things like, krill oil or, some of the oils. Another common problem in the brain with autism is, so that magnesium is a common issue. There's not enough. A lot of children have trouble absorbing their oils and myelinating in the brain, which is like, think of it like the wire to your computer has the rubber coating. The myelination is the rubber coating, in a sense. It's a good enough analogy for the wires in the brain. And when they are exposed, they're just your wire for your computer would. That's a good analogy, I think. So you want good myelination, and it's a problem in lots of brain function. And sometimes if you just add some flax oil or some omega-3s or some krill oil, which is, omega-3s, it solves itself, and they poo better.
Right.
So, and they're less depressed and they're more patient. Why? Because their myelination is happening. Did you need to watch, a ton of videos and try a bunch of different stuff? Not really. These are some simple things you can do to help brain function for yourself too.
Right. I also want to point out, just by putting a stool underneath their feet is, making sure that the feet, so basically, the child's leg is higher, because usually when we sit down, our feet are like this with
Right.
no stool. But when it's stool, the leg is higher than, like around maybe for adults, basically like halfway of your chest. And what it does is actually because I was,
No,
we're having
go on, it's good.
we're having this issue with gut, still, but not as extreme as before, because my doctor just said, put a stool on the feet. And then ever since then, and also we drink a lot of water. So that's a little extra stuff that, we drink a lot of water, and
Right.
basically it just releases itself and she goes to the bathroom. So that's something, but magnesium, I'm definitely going to try.
And actually what you, just to finish on that, so the reason is that you're pulling your knees up to help with the colon. It's a similar thing to what you'll see kids do when they want to stand and push. They're just trying to work that area. The healthier way to poo really is in a squatting position, which is what you're talking about. Sometimes the kids will squat on the toilet itself because the stool's not enough of a difference.
Mm-hmm.
Or for children who are very adverse to going, I often get them trained by getting them to start by pooing in the shower or the bathtub. At least it's a contained space that's on purpose, easy to clean, and then they move from there to, so remember, it's a spectrum. So for some people, I don't want you to feel like that was bad advice to do the stool, because I love that you mentioned it. It's actually very good advice.
Mm-hmm.
But some people have a bigger problem than that. And so build on that, generalize as parents and say, well, why the stool? Bring the feet even higher. Let them put their head forward. It's about positioning to give that extra pressure on the colon and angle it differently.
Yes.
So those are some things.
Yes.
We're at the end, so I suppose I'll stop.
Yes. It is an hour, yes. Between 40 minutes an hour, that's what I asked. And I really do appreciate, I had a lot of questions that you already answered. I really do appreciate, you having your time with us. Again, you guys, this is what it is. Let's Chat is always about resources out there, updates with Jasmine, and also, just basically acknowledging the expertise. I'm just a mom. That's what I am, just a mom, and learning still about autism. I hope you guys have enjoyed our chat. Please share it to whomever that you know that may benefit with this. Thank you so much for thank you so much for doing this with me. All right, until next time, you guys, have a good
Bye.
Bye.